Cardiac arrest. 1. Pathophysiology. Cardiac arrest is a sudden loss of heart function, which leads to the immediate cessation of blood circulation. It is typically caused by an electrical malfunction in the heart that prevents it from pumping blood effectively. This results in a lack of oxygenated blood to vital organs, including the brain, causing rapid unconsciousness and, if untreated, death. Cardiac arrest is a medical emergency that requires prompt intervention with cardiopulmonary resuscitation (CPR) and defibrillation to restore normal heart rhythm. 2. Onset and duration. 3. Prevalence. 4. Signs and symptoms. The signs and symptoms of cardiac arrest are typically abrupt and severe. Loss of consciousness. No pulse. No breathing or abnormal breathing. Cyanosis. Dilated pupils. Seizure-like activity. 5. Complications. Without immediate resuscitation, cardiac arrest leads to death, anoxic brain injury, organ failure, post-cardiac arrest syndrome. 6. Causes and risk factors. Cardiac arrest can be caused by a variety of cardiac and non-cardiac conditions, including, for cardiac causes, ventricular fibrillation (VF), ventricular tachycardia (VT), acute myocardial infarction (AMI), severe bradycardia or heart block, heart failure, congenital heart defects. For non-cardiac causes, electrolyte imbalances, drug toxicity, respiratory arrest, drowning or suffocation, severe trauma. 7. Tests and diagnosis. In the event of cardiac arrest, the primary focus is immediate resuscitation rather than diagnostic tests. However, once the patient is stabilized or if the cause is unclear, diagnostic testing is used to identify the underlying cause. Electrocardiogram (ECG), cardiac biomarkers, coronary angiography, echocardiography, electrolyte and toxicology screening, chest X-ray. 8. Treatment and medications. Treatment of cardiac arrest focuses on immediate resuscitation followed by post-resuscitation care to improve survival and neurological outcomes. About immediate management. Cardiopulmonary resuscitation (CPR). Defibrillation. Advanced cardiac life support (ACLS). Epinephrine, amiodarone, magnesium sulfate. About post-resuscitation care. Therapeutic hypothermia targeted temperature management. Coronary intervention. Implantable cardioverter defibrillator (ICD). 9. Nursing points. Emergency response. Continuous monitoring. Education and training. Patient and family support. Coordination of care.